Hello everyone, welcome back to my channel. I'm Dr. Soumita Roy, Pediatrician, and today we are going to discuss 5 very important MCQ in Pediatrics for your neetpg exam. Okay, so let's get started with the first one. So you see, student, read the question carefully. This is a problem-based question. So a 25-day-old male neonate is brought to emergency with repeated episodes of non-bilious vomiting after each feeds. All of the following is true regarding the diagnosis except. So for this, first you have to make the diagnosis, and then after doing the correct diagnosis you will be able to pick up the right option. Right? Okay, so the first option is it can present as late as fifth month of life. True. Hyperbilirubinemia is a common clinical association. It leads to hyperchloremic metabolic alkalosis and it is treated by pyloromyotomy. So, first let's do the diagnosis. This is a case of congenital hypertrophic pyloric stenosis, CHPS. Okay. So, yes, it can present as late as fifth month of life. Yes, this is right because it generally presents after third week of life, but it can present as early as first week of life, after first week of life, to as late as fifth month of life. Right, students? Okay, so next is hyperbilirubinemia is a common clinical association. Yes, there is something called icteropyloric syndrome, okay, where this chps is associated with hyperbilirubinemia. Okay, now moving on to the third option, it leads to hyperchloremic metabolic alkalosis. This is wrong. Why? Because it leads to hypochloremic metabolic alkalosis, right? So students, each of the words are important here. Okay, so and it's treated by pyloromyotomy. This is also right. And what is the name of the operation? It's Ramstead pyloromyotomy, right? And what more you need to know from chps? What is the usg finding? Yes, this will give you something called string sign, shoulder sign. Okay, so all of these are the potential MCQs. So here the answer will be C because this is all of the following is true except. Okay. So next, moving on to the second question of the day. So this is basically a one-liner. So read it properly. Carbohydrate digestion mostly takes place in which part of the intestine? So read the options carefully, students. It's proximal duodenum, distal duodenum, ileum, and colon. So here the answer is distal duodenum. Here majority of carbohydrate digestion takes place. Okay, and iron iron takes place iron digestion or absorption takes place mainly in the distal duodenum and proximal jejunum. Okay, and what about your bile salts? Bile salts and vitamin B12 absorption takes place in your distal ileum. Clear? Next, moving on to the third question of the day, and that is surgical closure of cleft lip and cleft palate should be performed respectively by. So basically, students always remember cleft lip is repaired before the cleft palate. Okay, so and cleft lip is more common in males. Okay, and it is commoner on the left side. Okay, it's repaired at 3 months of life. And what is the name of the technique? Yes, it's modified Millard rotation advanced technique, right? And cleft palate is repaired after cleft lip, as I said, and this is done at 1 year of life. Okay, so here the answer is C because it's 3 months and 1 year. Okay, so moving on to the fourth MCQ of the day, and that is what is the length of esophagus at birth? So basically, students, all of you are knowing the length of esophagus in adults is 25 centimeter. Okay, and at birth it is around 8 to 10 centimeter. Esophagus is developed from postpharyngeal part of foregut. Okay, and this is lined by non-keratinized squamous epithelium. Clear? And the length at birth is 8 to 10 centimeter, and within first 2 to 3 years of life it reaches the adult value of 25 centimeter. Right? So here the answer will be option A, 8 to 10 centimeter. Okay. So moving on to the last MCQ of the day, and that is a bit difficult one. So let's read out. Cyclical vomiting syndrome is characterized by all except. So look at the options. Option A is onset is more than 10 years of age. There will be family history of migraine in first degree relatives. It's of stereotypical pattern and it returns to baseline between the episodes, right? So basically, the onset is between 2 to 5 years of life. Okay, so definitely here the answer is going to be A. And yes, this is true that there will be history of family history of migraine. It's stereotypical and it will return to baseline between the episodes. So let me show you the criteria of cyclical vomiting syndrome. So these are the criteria basically. Okay, there will be at least 5 attacks in any interval. Okay, or a minimum of 3 episodes during a period of 6 months. Okay, there will be recurrent episode of intense vomiting and nausea lasting 1 hour to 10 days. Okay, it's stereotypical definitely, and vomiting during episodes occurs more than equal to 4 times per hour and for more than 1 hour. Okay, it will return to baseline and it's not attributed to any other disorder. Right, students? So this is all about the 5 MCQs I told you. Okay, so we'll be meeting again soon with a lot more important topics. Thank you for watching the video.